In this training, we're going to look at how chronic stress affects the body and why understanding the stress response is so important when we're using light therapy. This is an important foundation of the Zelmer Method because we're not simply putting light on an area of the body. We want to understand what may be affecting the body's ability to recover so we can use light therapy strategically. Let's start with fight or flight. Imagine you're startled by a loud noise. Your heart races, your muscles tighten, you feel an instant rush of energy. That's your body's fight or flight response. And fight or flight isn't bad, it's our natural survival response. The problem happens when the stress continues and the body has difficulty returning to a state of rest and recovery. This is where we need to understand the difference between acute and chronic stress. Acute stress is short term, and injury is a good example. Your body responds to the immediate physical stress, and ideally, as the injury heals, the stress response decreases. But what happens when the pain doesn't go away? Now that physical stress can be ongoing. The longer your body remains under stress, the harder recovery can become. And this is important when you're working with clients in pain. Pain itself is a physical stressor. Stress isn't only caused by an injury or an emergency. Think about all the modern day stressors: daily traffic, work-related pressure, pushing yourself too hard, living at a fast pace, an unsustainable schedule. And for many people, several of these are happening at the same time. Day after day, the body continues receiving signals that it needs to stay on high alert. Over time, that can make it more difficult to shift into a state of rest and recovery. The adrenals. The adrenal glands are small, but they are powerful. They're located directly above the kidneys and play an important role in the body's stress response. Understanding their role is important because the adrenals are one of the secondary placements I use within the Zelmer method. Before we talk about the placement itself, I want you to understand why we are targeting this area. When we're under stress, our body releases hormones, including adrenaline and cortisol. Cortisol isn't bad. We need cortisol. It's part of our normal stress response, and it helps the body respond to a challenge. The concern is when stress becomes chronic and the stress response system remains activated for prolonged periods of time. That's when we can begin to see effects throughout the body. And you can see some of the effects on this slide. Chronic stress can be associated with increased inflammation, fatigue, brain fog, changes in mood, and metabolism, digestive problems, changes in immune function, weight changes, and disturbed sleep. This is why chronic stress isn't simply about feeling stressed. It can affect multiple systems throughout your body. When several of these things are happening at the same time, recovery can become much more difficult. When you're under chronic stress, sleep can become disrupted. You may have trouble falling asleep, staying asleep, or you may feel what many people describe as wired but tired. This matters because sleep is one of the major times when the body goes into recovery and repair. Stress affects our sleep, poor sleep affects recovery, and poor recovery makes it more difficult for the body to deal with ongoing stress. Chronic stress and cortisol can also affect metabolism and body fat distribution. Visceral fat is different from the subcutaneous fat stored just underneath the skin. Visceral fat accumulates deeper within the abdominal cavity around organs such as the liver, pancreas, and intestines. It is metabolically active and is associated with inflammation, insulin resistance, and other metabolic health concerns. This is another example of how prolonged stress can have effects that reach far beyond simply feeling stressed. Now, I want to bring everything we've just talked about back to your work as a light therapy practitioner. Start asking a different question. Instead of only asking, where does my client hurt? Ask, what is happening in the body that may be affecting this person's ability to recover? That shift in thinking is extremely important, and why learning from an active practitioner makes such a big difference in your ability to become a successful light therapy practitioner in a shorter period of time. If somebody comes to you and says, my shoulder hurts, of course, we can use light therapy on the shoulder, but please don't stop there. Within the Zelmer method, we're looking beyond the symptomatic area. We're considering what else may be affecting that person's recovery. That's when we move from simply treating an area of pain to developing a treatment strategy. And the foundation of the Zelmer method is all based on treatment strategy. This is where two important parts of the Zelmer method come together: the adrenals and the lymphatic system. When we use the adrenal placement as part of our strategy to support the body's stress response and recovery process, we also target specific lymphatic drain areas to support lymphatic flow and the body's natural process from moving fluid and metabolic waste. This is why these placements are not random. There is a purpose behind what we are doing. And in the certification program, the whole goal is for you to have a full understanding of this by the time you graduate. So when you're building a treatment, I want you to look at the whole person rather than one symptom in isolation. For every placement you choose, ask yourself, why am I putting light here? Every placement should have a purpose. That's how you begin thinking strategically about light therapy. This brings us to one of the most important principles that I teach in the Zelmer method. I want you to write this down. When you reduce inflammation on a cellular level, you create an environment for the body to repair itself. This is what I have seen in my in-clinic practice for over 3 decades. You're going to hear me come back to this principle throughout your certification because it is fundamental to how I approach light therapy. We're working to create an environment in the body that supports the body's own recovery process. And now I want you to bring everything together. There's a big difference between using a light therapy device and having a light therapy treatment strategy. Before choosing a placement and offering a treatment to a client, I want you to think about 3 things. Why am I choosing this placement? What am I trying to support? How does this placement work with the rest of my treatment? And how can it help my client? Those are all the questions I help you answer in the light therapy certification program. When you can answer those 3 questions, you're no longer simply putting light therapy on a person. You're thinking strategically, and that's one of the fundamental principles behind the Zelmer method. If you would like to help more clients grow your business with light therapy, reach out to me to see if my certification program is right for you and your business. I look forward to talking with you.